All right, part 3 on what your urine analysis, your UA, is telling you about your body. We're going to talk about the rest of the chemistry portion. So this is the blood, the leukocyte esterase, the nitrites, the bilirubin, and the urobilinogen on the dipstick analysis. So generally under normal conditions, there should be no blood in your urine. It should be completely negative. If there is some blood there, then we need to do a microscopic examination. So if there is any blood there and we do a microscopic examination, what we might see is amorphous things or normal red blood cells. So myoglobin and hemoglobin can cause positive results for the blood in this dipstick examination, but so can red blood cells. If the red blood cells on microscopic examination are considered dysmorphic, which means they're like really misshapen, and this is more than 25% of them, then this means that there's some red blood cells that are leaking out of your glomeruli up in your kidney, and this is a very bad thing. So anytime there is suspicion of glomerular bleeding, we want to work that up further. Now, one tidbit about blood in the urine is that if you are a long distance runner, or if you're an athlete who like works really hard, or if you're just a normal person who doesn't really work really hard and all of a sudden decided to work like really hard, you can end up with a little bit of blood in your urine. And this, for the most part, is normal. Usually we would just retest this a few days after just to make sure that you didn't like really hurt yourself too much. And generally the body is resilient, so it might just be a one-time thing. So moving on to the leukocyte esterase. This is more of a white blood cell sort of thing, and you also want to confirm on the microscopic exam of the urine analysis. So if you see more than 10 white blood cells per field of vision and the leukocyte esterase is positive, and the patient has some symptoms like pain with urinating, it feels more urgent when they need to urinate. This generally means that someone has a UTI. And then we have the nitrites. So under normal circumstances in which you don't have an infection, nitrites should be negative. If the nitrites are positive, this is really highly specific for gram-negative bacteria. And the gram-negative part is important to know because sometimes it can change the antibiotics that we're trying to give to resolve this UTI. And then we have the bilirubin and urobilinogen. The bilirubin, under normal circumstances, is negative. The conjugated bilirubin that appears in the urine is usually indicative of some sort of liver thing going on. And in that case, we want to look into that again a little bit further, maybe with some blood work. Now, in contrast, the urobilinogen, the normal ranges is between 0.1 and 1.0. If it's more than that, that suggests that there's some sort of like blood cell destruction further in the body where your liver is then like filtering it out and you're having that increased urobilinogen that is getting excreted from processing a bunch of exploded red blood cells. It can also indicate that you have something liver going on as well, so that also needs a little bit more workup, ideally through blood work or imaging. Now on the flip side, if the urobilinogen is completely absent, this usually indicates that there's some sort of biliary obstruction where the bile is just not getting out. So this also needs workup if that is also something that's going on. So yeah, that's a general overview of the rest of the chemistry portion of a urine dipstick. In the next video, I'm going to talk a little bit more about the specifics of microscopic examination of what might be going on in your urine. I know I talked a little bit of some of them. Generally, where there's some chemistries that are positive, you want to do confirmation with the microscopic analysis. So yeah. If you guys have any other questions about what we covered in this video, go ahead and drop it in the comments for me, and I'll see you in the next one. Hope this helps.